following is a Cable 14 special presentation.
Welcome to the second day of the 2021 Seniors Virtual Event, Aging Well in Hamilton. There are many people in the community living with dementia, and the number is growing. Empowering dementia-friendly communities is a project led by the Hamilton Council on Aging in partnership with the Alzheimer Society of Hamilton. Tracy Gibbs is the project manager with the Hamilton Council on Aging, and Phyllis Fair and Debbie Key are Hamiltonians living with dementia. Take it away, Tracy.
Hello, my name is Tracy Gibbs. I'm the project manager for the Hamilton Council on Aging, and I'm joined by two of my colleagues, Debbie and Phyllis, to share about the Empowering Dementia-Friendly Communities initiative with you today. It's estimated that there are approximately 12,000 people living with dementia in Hamilton and Haldimand, and this number may almost double by 2030. A dementia diagnosis has an impact on the person living with dementia, their formal and informal caregivers, and whole communities. Dementia-friendly communities are emerging as a promising practice to help improve quality of life for people living with dementia and their caregivers. A dementia-friendly community is defined as a community where people living with dementia are understood, respected, and supported. It is an environment where people are aware of and understand dementia, and where people living with dementia are included and have choice and control over their day-to-day lives and level of engagement. For this presentation, we are going to talk about stigma around dementia and its implications, how the role of persons living with dementia in the global movement has led us to this point, and end with a brief overview of our local dementia-friendly project. I'm pleased to invite Debbie, who will get us started.
Hi there. Thank you, Tracy, for the introduction. My name is Debbie Kay, and I am living with young onset Alzheimer's, a dementia. I want to ask, due to my memory impairments, that I am having to refer to notes, so I thank you for your understanding. As mentioned, there are many challenges with the diagnosis of dementia. And for me, one of the biggest challenges was stigma, because I had a family history, a long family history of individuals living with dementia, and it wasn't a pleasant history. Due to my stigma, it had a profound effect on how I responded to my diagnosis. And I'm not the only one. Many friends, many peers experience the same thing. To help develop a dementia-friendly community, one thing that needs to be addressed is stigma and its elimination. We can do that through a community dementia-friendly community. Stigma can be described as a strong feeling of disapproval that most people in a society have about something. Stigma can be painful. Upon diagnosis, someone with dementia is almost always labeled and valued less than others by those around them. People living with a diagnosis can be excluded in decision-making and participating in activities that they love to do because other people assume that they can no longer do them. As an example, people will have a conversation, you're present, but you're not involved in the conversation. And some people might even ask a question about you, not to you, but to the person next to you, feeling that you're very isolated and just absent from the conversation in total. For me, all the negative beliefs, the stereotypes, the assumptions came to the surface like a tsunami. I internalized all these beliefs about dementia. Stigma has serious consequences for a person living with dementia and serious consequences for the support that they receive from others. It can hinder, make people feel incompetent, not listened to, and overlooked. This can lead to depression and social isolation. Some people living with dementia even fear discrimination and will not share their diagnosis with those closest to them. When people think about dementia, they often jump to the end stage of dementia. There is little spoken about the different stages, from early onset to the end stage. For many of us, there are many years left for us to enjoy a very good life. There is no mention that a person with dementia can live a normal life for years, even decades after diagnosis. In a dementia-friendly community, people living with dementia do not experience stigma. They are accepted, understood, and respected as any other valued member of the community. These are the things that I would like people to know. Every person living with dementia is unique. No two journeys are the same. People living with dementia are resilient. They learn new ways of doing things, but in a different way. We may need assistance with certain things from the community, such as help from a cashier to complete a cash transaction, or engage in everyday daily life and enjoying the things that we love to do. Some assistance may be needed, but we're still living independently. Don't rush us. We may need some extra time. And be specific when you're asking us a question or if there's something that you think we might like to do. We are still us, and we can be independent, and for some, as mentioned, they might need a little bit of help. We have lots of knowledge, experience, and skills still that we have from our past, and we can use those skills still and meaningfully contribute to the community. We can continue to learn new things and grow and have the potential to experience a positive quality of life with dementia. For me, I feel most supported when people ask me how they can assist me and accept me the way they accepted me before the diagnosis. Not everyone is going to go through all of these feelings, thoughts, or experiences. They may experience some or none at all. People can learn to live well with this disability through support groups and learning from others who are living with the disease and support services in the community. We learn to cope and develop strategies to live our fullest every day and live well within our communities. Communities really do play an important part in helping people live well with a dementia, and that's why we need a dementia-friendly community. On that note, I would like introduce you to a new friend and colleague, Phyllis Fair.
As a person living with young onset Alzheimer's here in Hamilton, I have made it my choice to advocate for all others living with dementia. You see, dementia runs in my family, and I've dealt with both my mother and grandmother who live with dementia. And when they lived with dementia, they were taken home and hidden away, and I vowed I'd never hide. And I'd use my voice the whole time to make sure things changed for people living with dementia. So back in 2015, I wanted change to happen, and I joined a group here in Ontario called the Ontario Dementia Advisory Group. We were a group of people living with dementia here in Ontario, and we wanted to make change. And in order to do so, we lobbied the Ontario government, and we were able to get the Ontario Dementia strategy put in place. And we continued to lobby the government because it was one thing to have an Ontario dementia strategy, but it was another thing to get it funded. So we continued lobbying. We worked hand in hand with the Ontario government to advise on policy. Then in 2016, I joined a group called Dementia Alliance International. It is an international group of people living with dementia, and they too lobby, but on an international scale. So in 2017, I spoke at the United Nations at the opening of the 17th session of the Charter of Rights of People with Disabilities. And what we wanted to make sure that was heard at that point was that people living with Alzheimer's and dementia should be treated as a disability. And because we decline and we want to stay at our best the longest. So I came back to Canada, and within 2 weeks, I had to go back to Geneva because Canada was reporting on its Charter of Rights of people living with disabilities. And so I went back as part of the civil delegation from Canada to say what we think Canada is lacking in doing. So when we did that, in the note back from Geneva to Canada, after they reported, dementia was mentioned in name, and this was the first time that was ever done in the world. So Canada had to really pull up its socks, so they decided to send it to the Senate for review. The Senate held hearings on Alzheimer's and dementia, and we watched, ODAG sat and watched the Senate do all these hearings, talking to researchers, educators, doctors, nurses, all these well-educated people on dementia. But at no time were they talking to people living with dementia, and who knows the disease better than the person living the disease and walking the walk. So we quickly sent a letter off to the Senate. We were accepted, and we spoke at the Senate, and out of the Senate hearing came the Canadian Dementia Strategy. And then in 2019, Canadian Dementia Strategy came into effect. Prior to that, they held consultations. We had a great big conference on it to see what everybody wanted and how we could make Canada a better place to live. And we were lucky here in Canada because Canada also funded the Canadian Dementia Strategy, and that leads us to where we are now. Part of that funding has gone towards creating this Empowering Dementia-Friendly Communities initiative. So I'd like to give you now back to Tracy. Tracy?
Thank you, Debbie and Phyllis. And now a brief overview of the local Empowering Dementia-Friendly Communities project. The Empowering Dementia-Friendly Communities project is a 3-year federally funded initiative led by the Hamilton Council on Aging, with the goal of being a catalyst for local change that improves the lives and well-being of people living with dementia in the community. Project partners are essential to the success of this initiative. Here is a list of the organizations and partners that currently make up the project team to steward this initiative. There are 3 main goals of the project: to engage people affected by dementia in Hamilton and Haldimand communities about their experiences, challenges in community life, as well as their ideas and solutions to make their communities more dementia-friendly. To take action based on this feedback, in partnership with people living with dementia, we will develop an education program, an anti-stigma campaign, and foster the leadership of people living with dementia to meaningfully participate in local change efforts. And lastly, to learn from this project and to share that learning with others. Last year, we engaged over 300 people affected by dementia in Hamilton and Haldimand County, using one-to-one interviews and surveys. We learned about the challenges and barriers to participating in community life and their ideas and solutions on how to make their communities more dementia-friendly. When asked, 97% of the participants felt that this project is very important or extremely important. Close to 170 people who were consulted requested to stay informed of the project and of future opportunities to be involved. This suggests that there is a need for this project and for change. It also suggests that people with lived experience care about this work and want to be involved. From this consultation, we identified 5 key themes for what people felt was needed in our community to become more dementia-friendly. The key themes from the consultation are framed as overarching action ideas. 1, empower people living with dementia. 2, challenge stigma and build understanding. 3, foster social inclusion and participation. 4, create dementia-inclusive built environments and transportation. And 5, improve community responsiveness to crisis, in particular COVID-19. You can find out more about the consultation, what we heard from people affected by dementia, and action recommendations in the What We Heard report on the Hamilton Council on Aging website. We hope it inspires others to learn about and be involved in making their community more dementia-friendly. In partnership with the Age-Friendly Hamilton initiative, we included dementia-specific recommendations in Hamilton's age-friendly plan to create one of the first age-friendly, dementia-friendly plans in Canada. You can find the full age-friendly plan and the dementia-friendly communities What We Heard report on the Hamilton Council on Aging's website at www.coahamilton.ca. And while you're there, please consider signing up for our Dementia-Friendly Communities newsletter to stay informed about this work and activities of the Empowering Dementia-Friendly Communities project. We want to leave you with a thought. All people need love, L-O-V-E. People who are living with dementia also need love, L-U-V-E. Listening, understanding, validating, and empowerment. This project is made possible with the financial support from the Public Health Agency of Canada and a grant from the Alzheimer's Society Foundation. Thank you for your time and interest in the Empowering Dementia-Friendly Communities project.
Wow, wasn't that just incredible? Thank you, Tracy, Phyllis, and Debbie. Your presentation has created more awareness about the struggles those living with dementia experience as well as their caregivers. Thank you again so much for being so open. We're going to take a quick break, and when we return, we're going to learn about the tender, loving care in long-term care. The COVID-19 pandemic has divulged some horrific situations in long-term care homes across Ontario. However, there are good things that happen in long-term care homes. I would like to introduce Holly O'Doherty, Senior Administrator of Macassa and Wentworth Lodges, and Renee Guter, Senior Administrator of the Thrive Group here in Hamilton, to tell you more about the TLC in LTC. We'll start with Renee.
Hello everyone, and happy Seniors Month. Thanks so much for taking time out of your schedule to join us for this presentation today. Let's talk about the tender loving care in long-term care, or the TLC in LTC. My name's Renee Guter. I'm the Senior Administrator with Thrive Group, which is a nonprofit charitable umbrella organization that oversees 4 healthcare providers, 2 of which are community-based service providers, Able Living Services, and Capability Support Services. We also operate 2 long-term care homes in Hamilton, St. Peter's Residence at Shadoke and Idlewild Manor, both on the West Mountain. My colleague, Holly O'Doherty, will be joining me later today to talk about the impact of COVID-19. She is a Senior Administrator with the City of Hamilton Homes and operates Macassa Lodge on the Hamilton Mountain, as well as Wentworth Lodge in Dundas. Holly and I both are registered nurses with over 20 years experience working in progressive leadership roles in long-term care. Interestingly, we started our careers together many years ago, have kept in touch, and we're so excited to come together today and share our passion for everything long-term care with you. So let's begin. When we were asked to speak about long-term care, obviously the subject matter was vast, and we took some time to really think about what we wanted to talk about today. But we recognize that the impact of the pandemic for everyone has been so significant, and in relation to long-term care, it's left us all feeling a little apprehensive and unsure about what's out there. So we really thought we would try to help by alleviating some anxiety, by talking about the quality that exists within long-term care, and also helping you with some things to consider if you find yourselves in that time where placement in a long-term care home is something that your family is considering. For today, we're going to talk about different types of long-term care homes and factors that you might want to consider when choosing a home for your family or yourself. We'll also talk about resident rights and care standards, and then we're going to talk about the impact of COVID-19 on long-term care, and we'll turn our minds to the future as we look at what work is underway to make improvements based on our learnings through the pandemic. So let's begin. Long-term care is no stranger to the spotlight. I'm sure all of us watching the presentation today can think of great stories of things that have happened in long-term care that were amazing, like the launch of butterfly programs in long-term care homes out towards Toronto over the past few years. And then most recently, of course, we're all very aware of the sad stories that have been coming around about long-term care homes and some of the things that have taken place during the pandemic. So with all of that, you know, it's currently a fairly grim picture. And if you're in that position or time in your life where you're looking at placement for yourself or a loved one, how do you even begin to choose a home? So let's try to tackle some of that and give you some things to think about. It's really important to understand what long-term care is and what it isn't. So the definition of long-term care on the slide is a really important one to take note of. This comes from the Home and Community Care Support Services website. And long-term care is defined as the residential home that provides 24-hour care to people whose care needs cannot be met in the community. So generally speaking, people coming into long-term care require some support to get through their day-to-day activities of daily living. So maybe some help with food preparation, dressing, grooming, bathing, and so on. Whereas folks coming into a retirement home setting may not need quite as much care. They might need a little bit of help, and they would choose from an a la carte menu of services in a lot of cases and build in some services. Whereas in long-term care, it's totally funded by the ministry, and all of the care and support that you would require to live happily and safely in a long-term care home is provided for you by that funding. Accommodation rates in long-term care, oftentimes that's one of the first questions people have is what does it cost and how do I pay? Accommodation rates are set for long-term care homes by the province. So if you follow that link on the bottom of the slide there, long-term care overview, if you just type that into your search browser, you'll be able to come to the ministry's website, and that's where you can see information about the current costs of long-term care, as well as different features and things like that to consider when you're looking at placement options. So lots of resources there for you. Things to know about choosing a long-term care home. What might you want to think about as you're making this choice? There's lots of different types of homes. There's private or for-profit homes. There's non-profit homes. Every municipality in the province of Ontario is required to operate long-term care homes. Those would be considered municipal homes, like those that Holly is operating, and those would also be considered non-profit homes. And then the other important thing to mention when it comes to the type of home you might be considering is cultural designations. Some homes in the province do have a cultural designation, be it religious or cultural based, but those things might factor into your decision as well. For example, in Hamilton, we have Shalom Village, which is a home that's designated as a Jewish home. So we maintain kosher diet and things there. Really important to factor in if that's a priority for you and your family. Other things to consider when it comes to choosing a long-term care home are size. Some homes are very big with well over 300 beds. Other homes are quite small with less than 50. So do you want big, high energy, lots going on around you, or something maybe a little quieter and a smaller group of people to get to know? Some homes are tall buildings with many, many floors. So if you like height and want to be up high, you might really like that. Whereas other homes are just sprawling 1 or 2 story dwellings that might be more suited to your preferences and needs. It's also important to remember where the home is located and to choose a home that's located in a setting in the community that you would have previously enjoyed. So if you're a person that loves the urban core and you want to be right downtown, you probably want to choose a home that's in that area as opposed to one that's more rural, because it might be too quiet for you out there. There might not be enough going on around you, whereas folks that have grown up in a rural setting might really appreciate a more rural home with lots of green space around it, etc. Really important to factor those things in. Often our preferences don't change too much as we age. So really think about what you've liked all your life and what you might want to have in a long-term care home when you're making your choice. The services in all of these homes would, generally speaking, be fairly similar. We all are required to provide the same set of minimum standards or services in long-term care. So how do you even pick? Where do you start? I would really encourage you to try to get to know the homes that you're considering for placement. Go on their website, do their virtual tour, call the home. Some of them will even do a live virtual tour with you over FaceTime so that you can really try to take a look at the space. Unfortunately, due to COVID restrictions, we're not open for tours right now. So please do connect and try to do what you can to really familiarize yourself with the home to the extent possible so you can be confident about your choice. Home and Community Support Services is a great reference for you. These folks will be there to guide guide you through the placement journey. The website link is on the slide there, and I would really encourage you to check that out. They have a great guide for choosing long-term care homes with lists of questions that you might want to ask. I promised that we would talk a little bit about resident rights and standards for care. So on the slide, you'll see listed there different things: the Long-Term Care Homes Act, resident rights, service accountability agreements, and accreditation. All of those things are things that factor into almost every single long-term care home. These are the key things that drive quality in long-term care, and really it's important that you understand that these things exist and maybe do some reading to learn a little bit more about them, because again, these are the things that really ultimately are driving long-term care quality and service. So last but not least, I'll just leave you with this parting thought before I welcome Holly to take over. So your long-term care home, it's not going to be home, unfortunately. We try very hard. But what can happen is your long-term care home can feel like your home away from home. So pay attention to how it feels when you walk through the door. If you walk in and you love the way people smile at you and you feel welcome and like you fit in right away, pay attention to those feelings, because that TLC comes from that home away from home feeling. And it's really important that you feel like the fit is right for you when you get in the door. So pay attention to that. So good luck with your choices. And at this point, I'll turn it over to Holly. She's going to talk next about the impact of COVID-19 on long-term care, and like I say, the future of long-term care and some of the work that's underway to make needed improvements. Thanks so much for your attendance today.
Thanks so much, Renee. Very informative information. Let's now talk about COVID-19. The impact of what it's had in our long-term care homes. It is obvious that the COVID-19 pandemic has been a devastating experience for people all over the world. A great deal of work is being undertaken to understand the impacts of this unfortunate time in our history. One of those pieces of work is a report from the Ontario Auditor General, Bonnie Lisk. The COVID-19 pandemic has presented a challenge to health experts and government decision makers around the world that in many ways is unprecedented in its impact and complexity. This statement likely rings true for each of us today, and it was taken from the recently released Auditor General report titled Pandemic Readiness and Response in Long-Term Care. The audit was conducted in order to assess the level of pandemic readiness across the Ministry of Long-Term Care and the 626 long-term care homes across Ontario. Findings from the report illustrate that the pandemic highlighted long-standing problems of the long-term care sector. These include inadequate funding to support required staffing levels, use of ward rooms that included 3 or 4 beds, which contributed to the spread of infection prevention and control measures, which were not consistently practiced or well understood in some of the long-term care homes, and long-term care homes had been operating in isolation from the rest of the healthcare system. This report contained 16 recommendations, but it focused on 3 key areas: pandemic response, recovery, and modernization of the long-term care system. The findings of the Auditor General report were consistent with findings of another report that was also released in April 2021, which was the Ontario Long-Term Care COVID-19 Commission. As COVID-19 took hold through the spring of 2020, it ravaged the elderly, particularly those in congregate settings such as long-term care homes. In July 2020, the province appointed the commissioners that would work to deliver this robust report, and it needed to be completed for April 2021. The commissioners interviewed more than 700 individuals across our province, comprised of residents, families, staff, various government officials, including the Chief Medical Officer of Health. As I mentioned, the findings from the Commission report were consistent with the findings of the Auditor General report. The Commissioner's report also makes recommendations that are aimed at addressing the issues in long-term care. These recommendations will require additional funding, legislative or regulatory amendments, and various other changes within the government and long-term care homes themselves. Both of these reports are long and significant documents with a high level of important detail. But let's focus on what is happening to keep people living in and visiting long-term care homes safe. Long-term care homes are no stranger to quality improvement, and in fact, homes have been completing various quality improvement initiatives and reporting on them for many years. Some changes have taken place recently or related to our learnings from the pandemic. In April and May of 2020, all 27 Hamilton long-term care homes were partnered with either Hamilton Health Sciences or St. Joseph's Hospital to reduce the isolation that long-term care had previously been experiencing. These new partnerships focused on knowledge exchange, and the homes have been supported with various improvements in infection control. Various community partners have engaged with long-term care homes to support them during the times of the pandemic. Innovations in care have been occurring for years in long-term care, and the pandemic accelerated one of those innovations, LTC Cares. LTC Cares is a program where an ER physician from the Hamilton Health Sciences or St. Joseph's Hospital work with the physicians and nurses in the long-term care home to ensure the resident receives the right care at the right location by the right care provider. It involves the resident and the family in the decision-making to determine if the resident truly needs to go to the ER for a visit. In addition, the provincial government has also provided support to the long-term care homes with containment funding to help support the costs of the pandemic. These funds would be covered to help support personal protective equipment costs, increased staffing costs, which would include to support screening as you walk into our long-term care homes and the rapid swabbing clinics. Last but certainly not least, vaccines. Vaccines have been a game changer. They were prioritized for our residents, families, and staff, and we quickly saw a significant decrease in the number of outbreaks in our long-term care homes, and in particular, we saw a dramatic decrease in the number of residents in the outbreaks. If you haven't received your vaccination, please sign up today. The future is bright. It is widely believed that the COVID-19 pandemic has highlighted the critical importance of the federal government being involved in healthcare. Work is underway to establish national standards across Canada to support our long-term care homes. These standards will be informed by the lessons learned during the pandemic. There are two associations representing long-term care homes in Ontario, OLTCA and Advantage Ontario. Both are continuously advocating for long-term care homes at a variety of tables that have recently been established to make improvements in our long-term care sector. In particular, there is a table looking at changes to staffing levels within long-term care and another table reviewing the current funding models. Both require change in order to meet the needs of our seniors while ensuring safety standards are continually maintained. At a local level here, long-standing tables continue to meet with the aim of disseminating information and continuing with our community partnerships. As we move away from the LHINs and towards the ongoing formation of our Hamilton Health teams, new tables are being struck and the learnings from the pandemic are being considered in all of the planning. Thank you so much for choosing to view our presentation today. We hope that this has provided you with some useful information while reassuring you that long-term care is a place where you can expect to receive TLC both now and in the future. We wish you good health, and we would be happy to connect and answer any questions that you may have. Take care, be well, and stay safe.
Isn't that great? Thank you, Holly. Thank you, Renee, for letting us know that there is great care in long-term care. It's now time to take a look at another video put together by the Art Gallery of Hamilton. This one is titled Inuit Art in Hamilton.
Imagine for a moment that you've just been brought thousands of miles away from your home and family to a place where you must stay for a long time, perhaps a year or longer, and where you don't recognize the customs, the lifestyle, or even the language of those around you. Imagine that you don't really understand what has happened, why you've been brought there, or what's going to happen next. And add to that the fact that you've just been diagnosed with a very serious illness. This is a lot to take in, but this is the experience of over 1,200 Inuit people in Canada who were evacuated from their homes and their communities and brought south to Hamilton for treatment for tuberculosis in the 1950s and 60s. There are many similar stories across Canada at other hospitals in each province as well. To give you an idea of the scale of this experience, at one point around 1956, Hamilton, Ontario was home to the largest Inuit settlement in Canada. There were 332 patients at the Hamilton Mountain Sanatorium. This compares to the average northern community of between 1 and 200 people. The collection was first assembled in the late 1980s by Marvin Cohen, then the owner of the Arctic Experience McNaught Gallery in Hamilton, and it was later expanded to include more sculpture and textile works, after pieces that had been purchased, likely from the Sanatorium's shop on James South, were donated back to the hospital. Works had been stored in variable conditions and required a good deal of conservation. The collection is made up primarily of carvings in soapstone, but it also includes a range of other materials for adornments and details, including ivory, plastic, leather, and wood, along with some hand-sewn objects. A great deal of research, including consulting with Inuit Art experts, former staff from the Hamilton Sanatorium, and other researchers who were able to connect us with northern communities. We also met with a woman who had been a patient at the San when she was 5, and who shared her story from the time she left her home and family to the time she returned home over a year later. The San Shop, as it was called, sold art made by the Inuit patients in Hamilton. Other than a very small commission, patients received all of the money from sales. No patient ever received more than about $500 in a year, though, as rest and treatment were the first priority in everyone's daily schedule. The money earned by Inuit artists was spent on their own needs, like materials and tools for art making, watches, cameras, fabric, and treats. Some money was also sent home to their families in the north. Carvings ranged from about $2 for small artwork carved by a new artist to about $40 or $50 for larger works created by more experienced carvers. To provide some background, in 1867, tuberculosis was the leading cause of death in Canada. Proof that it was contagious led to organized efforts to isolate those who were infected. The rest cure was the most common treatment for tuberculosis until the 1950s, when it was replaced by antibiotic treatment. In 1905, the federal government took active steps to combat tuberculosis. Plans were made to establish sanatoriums in each province. And in 1906, the Hamilton Mountain Sanatorium was founded to provide treatment for people from Hamilton and the surrounding community. The mountain san began on donated land on the escarpment overlooking West Hamilton. It started with 2 tents and 8 patients. Segregation and regimentation was known as the sanatorium routine, and this meant essentially keeping people who were ill away from everyone else and following a strict routine of rest and healthy diet. In 1946, the Canadian government implemented a medical mass survey of Inuit and Indigenous peoples in northern Canada and evacuated those suspected of having tuberculosis and other serious conditions. The important idea that we take from this, though, is that instead of building new hospitals or enlarging or developing existing hospitals in the north, the federal government chose instead to implement large-scale evacuation of Inuit who were ill to hospitals and sanatoria in southern Canada. This had a major impact on Inuit lives, communities, and culture. Many patients who came south did not return home. Some chose to stay where they were, while others did not recover from their condition. When patients were well enough, they were allowed to participate in occupational therapy programs, including carving. Patients were still required to stay almost exclusively in bed, so they wore masks and carved from their hospital beds. Some patients arrived in Hamilton with impressive carving skills, while others learned to carve while they were there. More experienced artists taught others. A number of artists included in this collection went on to have successful careers as artists later. The soapstone was shipped from mines near Timmins in northern Ontario and would arrive in 5 different pre-cut blocks. Carvings were made using woodworking tools like hacksaws, heavy rasps, a series of graduated files, pocket knives, and linseed oil was used to polish the surface of the sculpture. To illustrate the popularity of the program, in 1958, Inuit patients at the Sanatorium were producing about 200 carvings a month at a retail value of more than $10,000 in a year. In the art therapy program, men carved, while women sewed clothes and dolls, knitted, crocheted and embroidered, and produced beadwork. There was ample equipment and materials available for patients to use, and some was available for purchase. Staff would shop for patterns and materials once a week, and lessons were provided for those who were inexperienced. Many carvings show scenes from daily life, often made up of multiple elements. These works tell stories of the life and community left behind, and offered a glimpse into a lifestyle that most Southerners had not seen. These works were very popular with collectors. Many carvers added elements to their stonework, including leather straps, small ivory details which could have come from buttons on their coats or small trinkets that they brought with them. At times they even carved detailed elements from plastic that would have been found in the hospital. There are many animals in the collection, in various sizes, species, and ranges of skill. This example is a highly skilled work. The artist has captured a very realistic of the image of the walrus with details in the whiskers, face, and flippers. This is also an example of an artist who went on to have a very successful art career following his time in Hamilton. As part of the consultation process that began in 2016, images of the collection were taken to communities in the North for feedback. Our consultants heard stories of family members who had spent time in Hamilton and recollection of some of the artists that had spent time there. In addition, we learned more about the carvings, including what the figures may have been holding or doing, or other details that could help identify an artist, community, or an animal. Some Inuit died on their journey to southern Canada, while others did not survive the disease in the sanatorium. These patients were buried in Woodland Cemetery in Hamilton with unmarked graves. There was a process for government teams to notify families, but many messages never went through. A memorial was made for Inuit patients that passed away while at the Mountain Sanatorium at the Woodland Cemetery. Returning patients were sometimes sent to the wrong location, and often in inadequate clothing for Arctic weather. Reintegration was extremely difficult for many patients because they had become accustomed to the mannerisms and traditions of southern Ontario. For many, communication was the main challenge, especially in young children. Many had forgotten their own language. Others chose not to return to the Arctic because they had been comfortable with their new lifestyle in the South. The Art Gallery of Hamilton takes its responsibility to this collection and the artists who created the works represented in it very seriously. Our learning and sharing this powerful story has just started, and it will continue to evolve as more is learned. The story of the Inuit in Hamilton is one that is not as well known as it should be, And with this collection, we hope that more people will learn about the events, the choices, and the impact of a difficult chapter in Canadian history.
Well, that was a nice treat, a little behind-the-scenes look there. Thanks again to the Art Gallery of Hamilton for putting together another fantastic video for us. And getting information and accessing resources can sometimes be challenging. The Hamilton Public Library has a number of programs and services for seniors and has recently launched a new guide, Community Resources in Hamilton for Older Adults. Elizabeth Blackall, branch manager with the Hamilton Public Library, is here to tell you more about the library's programs and services for older adults.
Happy Seniors Month to all of you, and thank you for having me here. I'm Elizabeth Blackall, a manager from Hamilton Public Library. As your public library, HPL is here to help every member of the community succeed with lifelong learning and stay connected to information and resources that support healthy aging. Hamilton Public Library is a proud partner of Age Friendly Hamilton. Today, I'm happy to tell you about two community resources that HPL makes available to you. HPL's online guide, Community Resources in Hamilton for Older Adults, and the Redbook of Community Information by HPL. Community Resources in Hamilton for Older Adults is a reliable and up-to-date guide where you can find lists of services, programs, and resources for older adults in Hamilton. You can visit it at www.seniorshamilton.ca. This simply laid out website includes lists about aging in place, driving and transportation, housing options, living a healthy life with a chronic condition, and much more. Each category contains easy-to-read and up-to-date information about government agencies, nonprofits, charitable organizations, and social services. In the list, you'll find the phone number, address, website, and other details about each program. You can also click on Download this guide to download and print the entire guide. Now let's take a moment to walk you through the website and show you how it works. This is the website, seniorshamilton.ca. By going to this website, you can scroll through a list of titles that describe different areas of information available on the site. You can also click on Download the Guide here to open a PDF file that is easy to print, and you can print the entire guide. When you find the subject you're interested in, simply click on it, and you'll see a clearly laid out list of all of the resources that are available in Hamilton, complete with the phone numbers, email addresses, websites, addresses, and program details of that program. When applicable, we'll also include any costs for the services and who is able to access the service. All of the information on seniorshamilton.ca comes from the Redbook of Community Information by HPL. The Redbook is an online resource that contains information for social services and community resources in Hamilton. It's a vital resource for community members, social service providers, and caregivers, where you can search for or look up information about local resources such as food banks, social groups, employment supports, and mental health services. The Redbook has also been recently designed, which I'll show you shortly, and HPL is proud to have recently won an award for this design. We invite you to visit the Redbook at redbook.hpl.ca. You can also get help by phoning a community navigator with Ontario 211 by dialing 211, and this service is available 24 hours a day, 7 days a week. Now let's take a moment to show you the Redbook. This is the website redbook.hpl.ca. When you come to the site, you'll see there's a large search bar that lets you type in what you're looking for. As an example, I'll search for meal delivery. You can press enter on your keyboard or click on the magnifying glass to search. When you get to the results screen, you'll see that The 1 of 6 results are listed here. And we also provide you with a convenient map to see where each service is located. If you find a service that you're interested in learning more about, you can click on it, and it will take you into a detailed record, which provides a description of the service in more detail, the organization that is offering the service, and then below you'll have the hours that the service is available, a phone number, an address, and links to the email address if you want to contact the organization, or a link to that organization's website. Through these resources, Hamilton Public Library provides trusted, up-to-date information about social services and community resources to the residents of Hamilton. I'd also like to take this opportunity to remind you that Hamilton Public Library continues to serve the community. HPL locations are open Tuesday to Friday, 1 p.m. to 6 p.m., and Saturday, 1 to 5 p.m. We're offering limited services including holds pickup, grab-and-go bag pickup, computer use, printing, copying, and scanning. HPL staff are also happy to assist you during these hours by phone at 905-546-3200 or by live chat or email at our website, www.hpl.ca. We are also providing a diverse array of virtual programs online at hpl.ca. Join any of our free programs and you can engage in conversations, learn something new, or listen to amazing music by local musicians. This summer, we also encourage you to check out our Hamilton Reads 2021 title, Blaze Island by Catherine Bush. To learn more, please visit our website at www.hpl.ca. Thank you, everyone, and please enjoy the rest of Aging Well in Hamilton.
Thank you so much, Elizabeth. The Hamilton Public Library is definitely the place to go for programs and services to find information. On the next episode, we will learn more about your bones as you age and all about selling your home in today's market. We'll see you then.